Welcome to Polk Place. I'm Brian Lacey, and joining me in studio is Alice Kohler. She is with Lakeland Volunteers in Medicine. She is the president and CEO. Welcome to the show.
Thanks, Brian. It's good to be here.
I want to talk a little bit about Lakeland Volunteers in Medicine. Talk to me a little bit about how it got its start, what it does, and where it is today. Absolutely.
I love answering that question. We turned 21, so we're all grown up last year.
Officially, we can go to the bar.
We've been able to vote for a while, we're 21, and we have provided free, compassionate, high-quality health care to people who are working and uninsured in our community. So folks can enroll with us who have not had access to health care, who need access to health care, who fit the eligibility criteria, which are pretty simple. You have to live in Polk County. You have to have some form of employment, whether that's go to work and get a paycheck. Mm-hmm. You can be a full-time student. You can be, a farm worker or a housekeeper or a caregiver, so if you're caring for young children or disabled spouse or elderly parents, we consider that working as well. And you can sign up with us. Your income just has to be below 200% of federal poverty, which is about $55,500 for a family of 4. And it adjusts based on the number of people in your household. But more than half of Polk County is at that income, so there's quite a few people out there who fit our criteria. The only other criteria is you cannot have any form of insurance. Okay. So working, uninsured, and under 200% of federal poverty.
Talk about the importance of needing a plan like this. So many times our emergency rooms are flooded with just non-emergency situations, and if you have a healthcare provider such as providing the services that you have, talk about the need for that within this community.
Yeah, absolutely. So that is one of our primary goals, is to alleviate the pressure on our emergency departments. For a long time, Lakeland Regional was the emergency department and remains the biggest. But now we've got quite a few other healthcare providers popping up, and we're able to alleviate those emergency room visits for non-emergency reasons. We all want to be able to go to the emergency room for actual emergencies. And if you or I were in a car accident, or our mother, brother, sister, we'd want the emergency department available to deal with a true emergency. And so we're able to help our patients manage their chronic illnesses, such as diabetes and others, so that those chronic illnesses don't result in a required emergency room visit, as well as give people an option to come to us for routine primary care to maintain their health, so that it doesn't get to the point that they've got to go to the emergency room for their primary health care.
I want to talk pandemic with you. Obviously, you guys were on the front lines of the pandemic and also coming out of it. Talk to me a little bit about your mission then and now, and some of the things that you faced.
Absolutely. So the pandemic was hard on everybody in a lot of different ways. LVIM, we remained steady, and we did not close our doors. We did not close our doors at all. We were able to add a telemedicine option, which has been really helpful at keeping people safe and providing continuity of care as well. Probably the biggest impact on Lakeland Volunteers in Medicine is in that little V in our name, our volunteers. Traditionally, they do make up 96% of our workforce. Most everyone that a patient sees in our building is a volunteer with staff support, but our volunteer population, we usually operate with about 300 volunteers, and at the height of the pandemic, March, April, May 2020, we were down to 57.
Wow.
So our whole staff was cross-trained and learned to do every job except for be a doctor. Mm-hmm. But everything else. And so it's really changed kind of the culture of our operation. So prior to the pandemic, we relied a lot on our retired citizens who had extra time to give, who could give 4-hour shifts, if you will, in volunteer time. And then, at the height of the pandemic, it wasn't safe for our older folks to come out and be around COVID. We wanted to keep them safe and preserve their health as well. So we encouraged them to stay home. parallel to that, hospitals were not able to accommodate students who were needing clinical hours. And so our volunteer population has really kind of shifted. Now we have more than half of our volunteers are actually students in pre-med programs, med programs, which has been kind of a neat change, but a definite culture shift to adjust to. So we're almost back to our pre-pandemic volunteer numbers, but having students involved has caused us to think a little bit differently about how we run our operation, because student schedules change every semester and students go home for the holidays, and so we have to be a little bit more on our toes with how we schedule, whereas people who live here and are here all the time can steadily give the same day every week, the same shift, and it's easier to schedule that way. So pandemic-wise, it was hard on all of healthcare. We weren't able to provide a lot of primary care services, like our dental clinic was not able to do routine cleanings for quite a while by government mandate. Same thing with routine health screenings. A lot of those weren't allowed to happen in all of healthcare, not just at LVIM. So we're seeing the need to kind of catch up on those now with our patients and make sure if a woman missed her mammogram in 2020, that we're able to go back to her and say, okay, let's get that scheduled and get you taken care of, and all kinds of health screenings of that nature.
Coming out of the pandemic, the federal government made money available with the American Rescue Plan. Board of County Commissioners made money available within the community to nonprofits. You were one of those. Talk to me a little bit about the process and what the money will be used for.
Yeah, absolutely. So we were approached by the county and asked if we had a use for some American Rescue Plan monies. And these monies are not renewable, obviously, so they're kind of one and done, one time. So we had to really think about how we would use them to expand compassionate healthcare in our community. And so a chunk of that money is actually being used to get the word out about our services. So you should be seeing and hearing more things about Lakeland Volunteers in Medicine around the county. It's helped us to, we have a goal of adding at least 500 new patients this year. And so that's what we want to do. We want people who qualify for our services, and there are quite a few of them in our community, to know about us, to hear about us, and come to us. It's free service available, and so a large part of that American Rescue Plan money is for getting the word out, and then for providing the care to the brand new patients.
We've got about a minute left. Anything that you want to add? Anything that we might have missed?
I mean, if you know someone who meets our criteria, if you have a housekeeper, a lawn care worker, a server at your favorite restaurant, if you know anybody that does not have health insurance and is working in our community, please send them our way. We want to help our community be healthy. And then the last thing I would like to say is, if you'd like to come volunteer with us, please call us. We need all the volunteers we can get. And perhaps most important at this moment is just to say thank you to our Polk County Board of County Commissioners for considering Lakeland Volunteers in Medicine for American Rescue Plan monies, and in addition to all of the indigent healthcare funds that we receive through the county.
Well, Alice, it's been a pleasure seeing you again. Normally I only get to see you during the Swan Derby, but you're going to come back and see me again, will you please?
Oh, yes. Last Friday in April is the Swan Derby. I got to get the plug in.
Always working that angle, aren't you, girl? All right, we'll see you soon, all right?
Thank you, Brian.
The mission of Lakeland Volunteers in Medicine is to provide free, high-quality, and compassionate outpatient medical, dental, and mental health care to the working uninsured of Polk County. All LVIM patients gain a medical home and have access to doctor's visits, diagnostic testing, lab fees, lab tests, ultrasound scans, and x-rays at no charge. Now, if you need more information on LVIM, give them a call, 863-688-5846, or look them up on the web at lvim.net.